So let's discuss absorption, digestion, and so you know this is starch. So and this is glycogen. If you take animal food, you may take glycogen, little bit glycogen, but generally we take starch. So do you remember how to memorize this amylose? I told you many O's are there in amylose. O's. So many O's are there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Many O's are there. So I told you many O's. Many O's are there. A million O's, you can call it. Many O's are there. Amylose. So this is because this alpha bond will form this helical structure. Alpha 1,4 bond will form helical structure. And this helical structure is straight chain structure. This is amylose is straight chain. So that is how you can remember amylose is straight chain, and this will directly broken down by amylase. And the name of amylase also come from this because amylase act on alpha 1,4 bond. Alpha 1,4 bond. It does not. It is not able to act on alpha 1,6 bond. By now you know what is alpha 1,4 and alpha 1,6 bond from our glycogen topic. So it has capability to act only on alpha 1,4 bond, and the name of amylase came from this amylose because it will digest this amylose completely because it has got only alpha 1,4 bond. But what about amylopectin? It is not able to amylase is not able to digest this completely. Amylase is not able to digest this completely. How do you remember this this is amylopectin? So I told you just make an A, amylo, draw P like this. So amylopectin, you can remember this way. So this is A here, opposite A, and this is P here, like that. So you can remember amylopectin is a branch chain. Why I have given so that you will be able to differentiate what is amylose and what is amylopectin. So amylopectin is not able to digest this completely. This amylase is not able to digest this completely because it has got this branch alpha 1,6 bond. It has got branch here at branching, here also at branching. It has got alpha 1,6 bond. Alpha 1,6 bond. Here also alpha 1,6 bond. Here alpha 1,6 bond. Here alpha 1,6, alpha 1,6 at branching everywhere. Alpha 1,6, alpha 1,6. Wherever you see branching, there is alpha 1,6. So this alpha 1,6 bond cannot be broken down by amylase. You have to remember. So you can see, you already know this about this picture, alpha 1,4 bond, and this is alpha 1,6 bond. Alpha 1,6 bond is always at branching. In glycogen, we have done this. Alpha 1,6, alpha 1,6. This is alpha 1,6. These all are alpha 1,4. Now, this is very important. I think you will never forget that amylase. The name amylase came from amylose because it breaks this amylose completely. That is why it is called amylase. So that is how you can remember the name amylase. The function of amylase is only on alpha 1,4 linkage. Alpha 1,4 linkage. This is a very important question. Amylase act on which? Both alpha, only on alpha 1,4, both alpha 1,4, 1,6, only alpha 1,6. So you can remember it acts only on alpha 1,4 bond. So here you can see alpha 1,4 bond is broken here. Alpha 1,4 alpha. And this alpha 1,4, about when this amylose approach this alpha 1,6, it will stop about two sugar, before 2 sugar. It will not go beyond that. So there will be attachment of 2 sugar here, and there will be like attachment of 2 sugar here. So you can see the release is this tetrasaccharide. Okay, this type of saccharide will be released with this double bond. Okay, this with this double bond, and rest of this alpha 1,4 bond can be broken down with this amylase. Alpha 1,4 bond will be broken down by amylase. So this is how digestion happens. So digest alpha 1,4 bond, it will act on alpha 1,4 bond, it will act on alpha 1,4 bond just before this two monosaccharide. It will not break this bond. It will stop before this two monosaccharide. Okay, as you have seen in glycogen phosphorylase, so this bond will stop. Same logic you can use here. Two carbon, there four glucose, here two glucose. After two glucose, it cannot enter. So the same here. After two glucose, it cannot actually cross here. So this is the reason you will get a tetrasaccharide here. This is called alpha limit dextrin. A limit is there, and that is why this limits the 1,6 bond limits, and that is how you can remember the name limit dextrin. This limit dextrin is not digested by amylase. This requires a brush border enzymes. So you already know about the function of amylase. Let's talk about the further digestion. So amylase actually digests this starch into disaccharide. It, because of its many disaccharide, monosaccharide is released, trisaccharide is released, and disaccharide are released. Okay, so monosaccharide will easily be absorbed, but disaccharide needs further digestion. Trisaccharide also needs further digestion, and obviously this limit dextrin requires further digestion. So this will be digested. You can again see here. So this bond, alpha 1,6 bond, is not broken, and this immediately the bond that immediately follow this alpha 6 will also be not digested by this. So this will there will be release of this type of dextrinosis. You can see alpha limit dextrin. Okay, so we have done this. You can see, and now this alpha limit dextrin is digested by your intestinal enzyme, the intestinal brush border enzyme. These brush border enzymes are maltase, sucrase, and alpha dextrinase. Alpha dextrinase is specially designed to digest this 1,6 bond, alpha 1,6 bond. And there are many other disaccharidases. You can see maltose digestion by maltase, galactose, this is lactose digestion by lactase, sucrose digestion by sucrase. So these are the different enzymes that are present at the actually brush border. You can see this is the brush border. Here you can see this brush border. This is crypt of Lieberkühn crypt. You know this. So the brush border has this enzyme present here. All brush border has enzyme present. This brush border will digest this. Brush border enzyme will digest this. All disaccharidases and limit dextrinosis are attached to the membrane. It is the membrane protein. Okay, it is transmembrane protein, you can say, or superficial. It is bound to the membrane anyway. So membrane protein will digest. These are all membrane protein, all disaccharidases. These are all membrane protein, small brush border enzymes of a small intestine. These are not luminal digestion. This is membranous digestion. These are all membranous digestion. You have to remember. So disaccharidases are attached to small intestinal brush border. We have already explained. All disaccharidases are inducible except lactase. You know, lactase enzyme generally, when people grow, lactase enzyme then reduces in number in our body. And that is how lactose digestion is also compromised with age. Because this is not an inducible enzyme by lactase, it will reduce by age. So lactase is not an individual, it is a different thing. Lactase is a different, you can separate them from other. Rate limiting factor in absorption is this disaccharide. Because disaccharide, until this carbohydrate disaccharide is converted into monosaccharide, it will not be absorbed. That is why these disaccharides are the rate limiting step in digestion. More active the disaccharide is, more will be the absorption. Rate limiting factor for lactose absorption is hydrolysis of lactose itself. So you know, both places the rate limiting step is actually digestion of disaccharide. You can see here on the picture. So disaccharides are rate limiting step. You can see lactose will be converted into lactate. For this, these are the important rate limiting steps because there are multiple steps. For lactose, there is only one step. Okay, there is only one step. For other sucrose, there is only one step, that is sucrase is there. For starch digestion, there is first stage is amylase, pancreatic amylase, salivary amylase will act in your saliva, also called ptyalin. It is not that very active, so it will digest if you keep on chewing for a longer time. It will digest here. So it is not a major. It is major, but you should remember this also. So pancreatic enzyme will digest into trisaccharide, tetrasaccharide, limidextrin, and this will be digested further by this brush border enzyme. These brush border enzymes are the rate limiting steps. You have to remember, especially disaccharides. Now lactase will convert lactose and sucrase will convert into sucrose. This is very easy. And they will be absorbed into capillary, and from capillary they will reach liver. They will reach pancreas. From pancreas, they will cause secretion of insulin. And in liver, they will be taken up, and then glycogen will be formed in liver. And then if somebody has taken a lot more carbohydrate, fat will also be formed in liver, and it will be transported to adipose tissue. So this event goes on after digestion.